that when you asked for your first computer, didn't you? And I said, no, you're right. Okay, you can have my computer. And so, anyway, that was only the beginning. So then he proceeded to write a book on the computer, which I think in 2 months he had 150 pages. I mean, I've got witnesses here who've seen it. And his chief complaints, as they say, his chief complaints to me are likely to be, how many times do I have to tell you, Paul, I cannot use Windows 98. I want Windows 2000. This is a guy who, only 7 years ago, was, carrying sacks for a living. Anyway, yes, he wrote a book. And then the next thing is he asked the director of Partners in Health to name him to the advisory board of Partners in Health. And then he told me one time, he came up here with a patient once, from staying at Elliott House. Didn't like it very much. I lived there. Didn't like it very much. I shouldn't have said that. Didn't like it very much, but... and left, right after. But next thing I know, I was back in Haiti, and he was doing a mix of work at the time. He was starting to work more with the doctors on patients who had lots of social problems. So that's what he wants to do. He wrote this book, and we said, "Well, what do you want to do with your life?" He said, "I want to work for poor people." What are you going to say? You are a poor person? No, don't. We said, "Great. Like what?" He said, "Well, look at the way people live. We're not animals. Every human is a human. They need houses. They need jobs. They need waters." So his title now is Jean-Gabriel, Director, Project on Social and Economic Rights. And last time he came up here, by himself, he came back with little cards that said, on one side in English, and on the other side in Haitian Creole, and with a cell phone number that I didn't recognize, just that. Anyway, listening to the poor has been for I think our group really the compass of this work. And I want to close with some images. And this is a leader. This is a community health worker. Actually, this picture was taken by a New York Times photographer, and I'm almost sure it's from him. And she was on the cover of the New York Times. I guess it's not called the cover, but the front page. There's even other terms like above the fold or something. Someone said it's above the fold, and I was thinking, does that mean is that good or bad? But I brought it back to her, and she looked at it and said, "Oh yeah, thank you." Anyway, this is one of those community health workers, and the same day that this picture was taken, which it was an early day, I wasn't there. I showed her this picture. This was taken by the same guy. This actually is on the New York Times website, because this is when she first saw these. I was showing to her on the website, because lots of peasants now in that village know how to use computers. And when she looked at it, she didn't say, "Oh, there I am on the website." She said, "You wouldn't know which of the two of us had AIDS and which of us didn't if I didn't tell you." That's what she said. I said, "You're right." And this is a woman who takes care of her neighbors. That's her form of leadership in healthcare. She has all of the medications for the people in that village right in her house, usually in her bag. The same woman, after only 2 months of antiretroviral therapy, a young woman who's just learned that day that her baby does not have HIV, although she does, because she was part of a successful program to make sure that the virus was not transmitted. Or here's one of our community health workers in 1999 dying at home of AIDS, and a few years later at a party the patients were throwing. And you can see her words, heard yourself. Another person on the day, actually, was just with the medical student who took these two pictures. She's now in, I think, her 4th year. She was working with me in Haiti, and the day this guy came in, and she took both pictures, as I said, and he was part of a project we were doing to interview patients, and we were talking about stigma, and he was, the patients there were saying, "Stigma? Well, how about we start by making it not a lethal disease, and then we'll talk." And then this fellow, whose name impossibly is Holy Heart, Sankeo, and is part of the same project, dying of AIDS, taller than I am, weighing 80-something pounds, and then a couple years later. Saw him last week in clinic, not because he was sick, but because he wanted something to fix his soldering machine. A woman dying of AIDS, same woman giving a Health and Human Rights Declaration in a conference a year later. And this declaration you can read about. It's on the Partners in Health website in several languages. Of course, they gave it in Haitian, and it's been translated somewhat poorly into French and English and Spanish, but you can read it on the PIH website. And then I won't apologize for this last picture. But when I think about leadership and the challenges before us, I do think a lot about AIDS. This is a person who has both AIDS and TB, the number 1 and 2 infectious causes of young adult death in the world today. And this is his mother. And talk about leadership, all the leadership that women like she have offered us in not giving up. Because this is the same guy 5 months later. And I think I'll close there, and I look forward to brisk debate and critique. Thank you very much.
By you, and it should help with the sound. If you're not in a seat and would like to ask a question, if you just could speak loudly so everyone can hear.
And if anyone has chest pain, I do have my stethoscope right here.
So the floor is open.
I'd like to say something to my wife, who's not here. If she had seen those pictures, she would have been weeping, because her father died of AIDS 10 years ago. And it's just incredible.
I saw, thank you for saying that, I'm very grateful. I came from, I sat at a woman's room at the hospital, and her son had died of AIDS. She said to me almost that, when, her condition has nothing to do with HIV, but she just said, if only 10 years ago. Yeah, yes, please.
I come from Africa, and particularly in my country, I keep singing this song. We lose 500 people every day to HIV. I come from Kenya. And I'm looking at the work you're doing in Haiti and thinking about what else, are you doing anything else in the rest of Africa? Because, I'm envious looking at what's going on there and knowing what's going on in my own country now. Almost all graveyards are full up. They're trying to look for new graveyards because it's really getting out of hand. And I'm wondering what partners in health are doing in the rest of Africa.
Well, thank you for your question. We were just in your beautiful country recently. The director of Partners in Health and I were just there, and we were around first of all, you fly into Nairobi, which is, of course, is so different from Port-au-Prince. It's this big skyscrapers, and it looks like a rich city. And we know that Kenya's not a rich country, but it's the disparities hit you. Like I showed, I have this picture of Nairobi, and then a village in Kenya from the same trip. This is January, by the way. And then we went to Lake Victoria, where we saw what you described: all these children and all these elderly people, but no one in between. And I have to say that we were there to make an argument, and it was a very difficult argument because we were guests, but we weren't arguing with Africans. We were arguing again with people just like us. They were, it doesn't matter what organization, a good organization. But they had started a home-based care program in this region where HIV is a terrible problem, and it has been. And they had started this home-based care program, but they had not included any ARVs. So that means that these are the drugs that are specific, and the ones that I think
you're referring to indirectly.
Okay. They told us, one group told us, well, we enrolled, I think it was 1,300 people just a couple of years ago. And we said, great, for home-based care. And we said, great, how they doing? And, I think it was more than half of them were dead. So we had to find a way to say, We dig the home-based part. It's the care that isn't right. Because you can't care for this disease without the tools. Why are Kenyans